Hello, ladies and gentlemen. Today we'll be talking about what we describe as etiology of facial clefts. In other words, what are the causes of facial clefts? For those of us that are familiar with these conditions, facial clefts are medical conditions where children are born with openings on their lips or on the roof of their palate. So when it's on the lip, we call it cleft lip, and when on the roof of the palate, we call it cleft palate. And sometimes you can have a facial cleft that will affect other part of the face. One question that will interest most parents is, what is the cause of these facial clefts? It is important to appreciate the cause because it is important to appreciate this topic because a lot of different reasons have been ascribed to facial cleft. In different cultures, when children are born, the usual question is that of denial and disbelief. So people begin to wonder what could be the cause. To answer the question simply, the cause of facial clefts are unknown. Just like any birth defects, it just occurs. However, science has been able to classify what we call predisposing factors. Factors that have really been associated. They cannot really be said to be the cause, but they've been associated. So, they are divided into genetic causes and environmental causes. Let me talk about genetic causes. Genetic causes means that it is transmitted from parents to offsprings, and it could run in families. As a matter of fact, we found out that in about 5 to 6.5% of cases, of our own cases, we find out that you could have two siblings, brother and sister, that have clefts, or you could have I've had a sibling in which 3 members of the family actually have clefts, or a child has cleft and the uncle also has cleft. So you could have that. Then we talk about environmental factors. Environmental factors are factors where you can, some factors have been named each. For example, drugs. For instance, drugs that are used that are called anticonvulsant drugs have been known to cause facial cleft. Things like smoking, alcohol, something like irradiation. Some people will talk about some other factors, some vitamins. But generally speaking, this is very important for the purpose of enlightenment. Majority of the cases we have been seeing in Nigeria could be described as isolated. Isolated in the sense that many of these factors have listed, like smoking, alcohol. You find out that you don't find it in most of our people. For instance, smoking is not something that is too common to us, but still we find out that many of these clefts come. So in conclusion, or in summary, we can say that majority of the facial clefts we have are actually isolated in nature. You can hardly ascribe particular causes to them. But what is most important, and that we should all realize, is management of these patients once they are born. Because the causes are not really known for sure, issue of prevention is difficult. But what is important is comprehensive management, and comprehensive management centers are springing up all over the world. Let's present these babies as soon as they are born. Let's present them to these centers and they will be managed adequately. Management will involve surgery. Sometimes as they grow, it may need speech therapy, may need orthodontic treatment, and may need a host of other treatments. Thank you.